County officials announced new steps to combat a health scare that has reached the epidemic stage in Southern California. It's an outbreak of Hepatitis A, a highly contagious liver disease which is spread through poor sanitation or close personal contact with someone infected by the virus.
New at 5, CBS 13's Ed Crane joins us live at the California Department of Health with more. Ed?
Well, good evening, guys. Since 1995, Hep A has really not been a problem. There are only about 6 cases a year in Sacramento County. But back in November in San Diego and recently in Santa Cruz, it did reach epic proportions, as you said, and it hasn't stopped yet. Now state officials are urging Sacramento and other non-infected counties to take steps to guard against Hep A. That starts with vaccinating the homeless. Hep A is spread primarily through poor hygiene, a chronic problem among those without access to soap, water, or toilet facilities, or through heavy drug use.
You have people running around the streets sometimes and maybe the clothes are dirty, they've been defecated on, or they've been urinated on, or they just haven't been cleaned.
And that's why the county health effort will start at health clinics for the homeless, like the Mercy Clinic at Loaves and Fishes, first with vaccines and in cooperation with the city by bringing better sanitation to the street population.
And certainly Jeff Harris, my colleague here on the city council, working very hard on ensuring that we have adequate restroom facilities for people who are out on the street.
But it's not simply a problem among the homeless. In San Diego, more than 400 cases of Hep A have been diagnosed, 16 of them fatal, and in much smaller Santa Cruz, the number's up to 71. Because the disease is so contagious, it can be contracted in ways that might not cross your mind. Think of things you touch every day: a parking meter, gas pump, doorknob, or ATM.
When you have somebody who may be carrying that germ or bacteria with them, you may not be around them, but you're on a city bus or you're touching a doorknob of a public restroom.
Hep A is not pleasant. Symptoms include nausea, vomiting, and joint pain. Rest and hydration are usually prescribed, and the symptoms run their course in a few weeks. But for the elderly or those with existing liver problems, Hep A can be fatal. Now, doctors also tell us that the virus can lie dormant for weeks, and some people never get any symptoms at all. If you're concerned, a simple blood test can determine whether you have the virus. And if you are concerned that you would like to prevent it, your doctor can give you a shot. Some drugstores, such as Walgreens, will also give you a shot on the spot. Back to you.
All right, Ed, thanks very much. Live for us tonight in downtown Sacramento.